Antibiotics have been employed since the 1940s, and over the past 70 years, they have saved millions of lives. Their development has enabled advances in modern medicine that would not otherwise have been possible. Deadly diseases are no longer the threats that they once were. Antibiotics play a crucial role in agriculture and food production industries, preventing the spread of disease in livestock and food production to feed the world. However, antibiotics are the penultimate factor contributing to antibiotic resistance around the world. Penicillin has played a major part in the development of antibiotic resistance. Their increased availability and inexpensive cost has facilitated the overprescription and incorrect dosing of antibiotics. The World Health Organization has stated that antibiotic resistance is happening right now in every region of the world and has the potential to affect anyone of any age in any country. Antibiotic resistance occurs when few bacteria that would usually have been wiped out by a particular course of antibiotics change in some way that reduces or eliminates the effectiveness of the drugs designed to cure or prevent infections. These bacteria continue to survive and cause more harm. Resistance mechanisms include the ability to neutralize the antibiotic before it can do bacteria harm, the ability to rapidly pump out the antibiotic, and to alter the antibiotic attack site. The bacterium that survives the antibiotic treatment will further undergo asexual reproduction, enabling the rapid multiplication of resistant bacteria. Similarly, bacterium can acquire resistance by sexual reproduction, conjugation, and horizontal gene transfer, in which DNA coding for resistance properties are acquired. The bacterium will further replicate transferring resistance. When the next dose of antibiotic is given, these bacteria are unaffected and continue living and reproducing. Superbugs are strains of bacteria that are resistant to several types of antibiotics. Each year, superbugs infect more than 2 million people nationwide and kill at least 23,000 according to the US Center for Disease Control. Superbug methicillin-resistant Staphylococcus aureus is a strain of Staph aureus, also known as golden staph, which is multi-resistant to cephalosporin and beta-lactam antibiotics such as penicillins. Staph aureus is a usually harmless gram-positive bacteria found in the respiratory tract, on the nose, and on the skin. 20% of people carry the bacteria all the time, and 65% are intermittent carriers. However, Staph aureus can cause skin infections, pneumonia, and bloodstream infections and is easily spread through person-to-person contact or contaminated surface areas. In the past, an infection could have been cleared by a normal course of antibiotics. However, in the case of MRSA, both commonly and uncommonly used antibiotics may have little to no effect. The overuse of antibiotics, sterilizing solutions, and chemicals, along with immunocompromised patients, has been chiefly responsible for the development of MRSA in hospitals. MRSA was previously confined to healthcare settings. Now the bacteria has spread to the community, one population study finding that more than 85% of infections are occurring outside of hospitals. Community-associated MRSA causes infections in healthy people, predominantly spreading through schools and shared gyms. So what lies ahead for antibiotic resistance and superbugs? While there are many new antibiotics in phase 2 and 3 clinical trials, simply developing new drugs is not enough as bacteria mutate faster than we can synthesize the drugs to kill them. Genetic studies, phage therapy, and diagnostic testing are proving to be promising techniques for understanding and effectively treating antibiotic-resistant bacteria. Findings could assist in the discovery of innovative new treatments. What steps can be taken to address the problem of antibiotic resistance? Doctors should have a complete understanding of their patient's symptoms and confident that antibiotic treatment is appropriate. The use of cultures can allow targeted treatment of infections and avoid ineffective and unnecessary use of drugs. When prescribed antibiotics, it is vital the patient takes the full course. The antibiotic is not shared or saved for a future illness. Hand washing is advocated as a far more effective way of limiting bacterial transmission, and it does not contribute to resistance. This is especially important in the case of health workers to protect patients and themselves from superbugs. Maintaining a healthy lifestyle and good hygiene practices assist in the prevention of illness, thereby preventing the overuse or misuse of medications. Without effective antibiotics, we return to an era of high rates of fatal infection and extremely high-risk surgery. Superbugs are now a permanent threat in public health, and the development of further resistance is expected with current trends. However, effective health policy, targeted healthcare, and public awareness can curtail the development and spread of these superbugs. Antibiotics are possibly the biggest tool we have in fighting disease. Maintaining their efficacy is paramount in keeping people alive and healthy. Thank you.